How'd you guys survive week one?
Well,
Classes
we're
are all
here.
sit, huh?
We're here.
You're here. Yeah, I get you. I always get you on the Mondays of the new week. So
Yeah.
everybody get all their classes situated and
hmm
got everything. Okay. I don't think there'll be much more shifting of classes. I think everything had to be in all the changes, and there were a lot of changes last week. Um, Everything had to be in by Friday. So I should be getting my official, let's see, Celine.
Hi, Professor.
Hi, Cynthia, how are you?
Good.
Oh, Kadisha, hang on. Kadisha's here. Harris, Alicia Harris. I'm not Selena.
Here.
Hi, I'm just trying to find your name. Selena, are you sure you're in this section?
Yes.
Okay. Selena Guzman.
Broussard.
Oh, okay. All right. All right. All right. There you are. All right. This happened last week. I was confused. Chantel Moody. Okay. Lisa's joining. DeChantel, hi. How are you? What campus are you from?
Orange
Desha
Park.
Orange Park. All right, great. And then did I see Danielle come in? Danielle came in, right? Yeah. Danielle, hey, what campus are you from? Danielle.
Pensacola.
Pensacola, thank you. Okay. Um, let's see, we're missing Tavia, Keisha. Tierra's here. Kadisha's here. Virginia, I'm not sure about. Vanessa Stevens. Did she come in? I don't see her. Oh, there she is. Hi, Vanessa. Good morning or good afternoon. What is it? 3 o'clock for you guys, 1 o'clock for me.
2 o'clock. Good
Oh,
afternoon.
Central Time. So some of you Central, some of you East, right? Orange Park is East Coast time, right?
I don't know what we are.
What's your time zone? I'm
Um,
Mountain.
well, it's 3 o'clock.
Okay, so you're Eastern, and then we've got Pensacola, I think is Central. So it's probably 2 o'clock for Pensacola, right? And then 1 o'clock for me, Mountain Time. Yeah. Okay. So anyway, welcome to week two. Um, Everybody survived last week, got your classes sorted out, right? Everybody needs to be on camera, meaning I need to see your face. I can't look at ceilings and walls and stuff. So if you could get your face in the camera, I would appreciate it. Um, before we take our quiz, does
Professor,
yes,
I need a second very quickly, please.
pardon me?
I need a second very quickly.
Okay.
Thank you.
Um, so before we start a quiz, I just have a question. Does anybody have any questions from week one? Two parts of week one. Week one was the orientation PowerPoint that I went through, and then we went through our last week's lecture. PowerPoint we went through, then we went through the syllabus, and we went through the modules. Okay. Does anybody have any questions about that? I know if you took 3 classes, you got the PowerPoint 3 times. If you have 4 classes, you got the PowerPoint 4 times. So, does anybody have any questions about anything that was in the PowerPoint? I sent it to you ahead of time, so you have a copy of it in case you need to refer back to it. Does anybody have any questions about the modules or the syllabus?
No.
Okay. Okay. And then last week I sent you week one announcement with content notes. And then yesterday I sent you the week two notes. So that's what we're going to cover. Do a lecture after you guys take the quiz. We'll review the quiz and then we'll talk about all the content for weeks 1 and 2. Two things I have in the works that are going to be coming in the next 24 hours, I hope, are at least in the next couple of days is the review schedule. Okay, remember I told you I would provide you with a master review schedule with reviews for exams 1, 2, and 3 and HESI. That's coming. I'm going to provide you your groups this week. So if you want to get going on working on your week 7 group project, great. And then I hope to have the concept study guide for exam 1 to you guys by the end of the week. Okay. Then you'll have a couple of weeks to have that.
Thank you.
That's all coming. Yep. So does anybody have any questions? Okay, the quiz is considered a KGA, so it has to be proctored. So I've already turned it on. I turned it on before class. So I'm going to give you guys 15 minutes. It's 10 questions. Okay, when you're done, just if you need to go away from your camera, that's fine, but don't log out and come back in. Okay, just and I don't need to know that you're done. I can tell kind of by looking at everybody where they're at. But the quiz is uploaded. The content is from a little bit from week 1, mostly week 2. So hopefully if you read your notes and did your readings, you'll be fine. And we'll go over it after. But you got to stay on camera for the quiz. And if you're done before 15 minutes, just hang out, or if you need a bathroom break or whatever. Okay. So you guys are, everybody mute themselves. Okay. And I'm going to mute myself. And so go ahead and start taking the quiz. Let's see, it's 3:05. We'll go to 3:20. How's that? So at 3:20, we'll come back. All right. So go ahead and start taking the quiz. How's everybody coming? I have 3 students that haven't submitted. Tiara, you need to submit your quiz when you're done, if you're not done. Jatarius, you need to, if you're when you're done, make sure you submit it. It's 120 or 320. And then I think it was Lakeisha that needs to submit it. How'd y'all do?
Pretty good.
Do okay? I just need to wait for our last 3 students to submit. And we'll review it. Tiara, did you submit it? Okay, thanks. Jatarius, did you submit it? Okay, great, thank you. Lakeisha, what question are you on?
I'm on the last one.
Okay, go ahead. Just give me a thumbs up when you've submitted it, please. And then everybody needs to have their cameras on and be present, please.
I'm finished.
Okay, thanks, Lakeisha. Celine and Tavia, could you turn your cameras on, please? And Vanessa, you need to be in the picture.
Hey, Miss Marvel, are you aware that the correct answers are hidden for the quiz? Like we can't see the ones we got wrong.
Oh. Okay. Well, I can't correct that right now, but I'll correct that for future quizzes. But hopefully, as we go through the 10 questions, you'll know which ones you got wrong. Okay, but thank you for that. Let me make a note to that. Thanks, Kadisha. Appreciate it. Okay, let's go through it. All right. Share my screen. Okay, here's your quiz. All right, so, whoops. Which is an example of community-based nursing? Based on your reading from week 1 notes and the recording, you should have had an understanding of the difference between community-oriented and community-based. And we'll review that again after we finish reviewing the quiz. But can anybody tell me the difference before we answer this?
Community oriented is like as a whole, and community based is like focus on like individual.
Yep, perfect. Good job, Tiara. So Tiara, what would be the correct answer to this? Number
So the
1.
correct answer would have been educating a child and school teacher on the use of the inhaler. And I got it wrong, and I knew it.
Oh, come on.
I did. I knew it, and I still got it wrong.
Come on.
Pregnancy prevention program.
What?
Pregnancy prevention program.
Nope. So all the
That's
other
for
3.
that'll be considered that will be considered community oriented.
In a community.
And I
Right.
knew that, and I still did.
Oh, Tiara, come on. So all the other answers, A, C, and D, are all community oriented.
Yes.
And so
they
in your
are.
notes, in your first, where's our week 1 notes?
Yeah, and I
Here,
still did it
it's-
right at the top.
Right here.
Yeah.
In your week
I
1
still did
notes, here it is. So community-oriented nursing, right, is I just thinking about orienting yourself to the whole community. Community-oriented nursing. All right, you're focused on health promotion rather than illness care. It's a whole group rather than individuals. And this is right in your notes. We're community-based nursing. You're in the community. I consider myself based in the community. So I'm already based. I'm already taking care of clients. I'm in the community. Okay, it's the illness care. So that would be like a home health nurse, a school nurse, right? You're based in the community. You're a hospice nurse, you're a home health nurse, you're a school nurse. Okay? Occupational health nurse. It's illness care instead of the overall health promotion and the health maintenance of the entire community. So it's individuals as opposed to communities and population. Okay? So educating a child and a school teacher on the use of an inhaler is the example of a school nurse function. He or she is in the community doing the teaching or doing the demonstration, redemonstration. If you think about it, all the other three are community oriented. So developing a teen pregnancy prevention program, that's for the whole community. Evaluating outcomes of a community vaccination program, that targets the whole community. Providing diabetes education prior to a hospital discharge, that's the whole community. Okay, that's the big picture. Those are big picture things. We're educating a child and a school teacher on the use of an inhaler that's targeted to an individual. Does that make sense? What questions do you have about that? That's the whole difference. There's a stark difference, actually. Community-oriented nursing is also synonymous with public health nursing. Okay, so if you're a public health nurse, you're looking at the whole community, right?
I'm confused on why it's not providing diabetes
What?
Yeah,
education.
prevention program and pregnancy teen.
Say that again?
I'm just
Yeah.
confused on the question, I guess. I don't know.
So which is an example of community-based nursing? Well, if we know community-based nursing is targeted with individuals, that's what it says in your notes. Community-based, you're based in the community working with clients, school nursing, hospice nursing, home health nursing. You're actually in the community working. Where community oriented is you're trying to looking at the big picture. You're looking at the whole population. Does that help? Okay, because that's something we do need to understand. I think that's going to come up in exam 1. Number 2, if you went to the Healthy People 2030 website that was assigned in week 1, you would know what the purpose of Healthy People 2030 campaign is. Okay. What's the correct answer?
Is it the first
A.
one?
The first
Yeah.
one.
It's A, because it's a national framework. It's looking at the whole nation. Okay. It's not specifically targeting states. It's not specifically targeting certain problems. It's looking at trying to improve the health of everybody, not just the elderly, not just the kids, not just vulnerable populations, but it's a framework to improve the health of all Americans. That's their overarching goal. Okay, so the rest of the 3 answers are more specific. It establishes guidelines for treating the most common chronic diseases. Well, no, no, it doesn't. It doesn't do that. It creates a standardized nursing curriculum. It has nothing to do with nursing curriculum, right? It changes the focus from community health to individual health. No, it doesn't do that. If you think about Healthy People 2030, it's a national program to try and improve the health of all Americans. Okay? Any questions about that? Okay, which is true regarding uninsured and underinsured individuals? Think about it. If you don't have insurance, you're underinsured, what potential risks might that pose for you?
The advanced disease or likely to
Advanced.
be.
Right. Number C, they're more likely to be diagnosed with advanced diseases. Why?
Because they don't get any preventative health care.
That's exactly right. That's exactly right. People that have no insurance or are underinsured typically aren't focused on their preventative care. Right? So by the time we actually see them, they're in a more advanced stage of whatever's going on. Does that make sense? All right. So actually, I'm looking at number A, they are less likely to attend preventative wellness visits. Right? B is just the opposite. They're more likely to develop preventable diseases. Okay, C is obviously the correct answer, and they are more likely, D is the opposite, they're more likely to need government health resources. Right? So being uninsured, underinsured comes with lots of potential risks, not only with not seeking preventative care, but maybe access is an issue as well. Questions about that? Okay. Question 4 comes from week 1's introduction to vulnerability. And your readings. So which clients belong to vulnerable populations? Select all that apply. I'll start with number 1. Why is A incorrect? Why is A not an answer?
Young woman pregnancy is
Yeah.
normal for women.
Common.
Great. 26-year-old pregnant woman is not considered vulnerable. Some may be, but it's more geared towards the teen pregnant mom.
And she's not younger, older.
Right. So if it said a 15-year-old or 18-year-old, that would be a correct answer, because 26-year-olds are, some may be vulnerable, but they're not labeled as vulnerable just because you're pregnant. Okay. What about B? Is that a correct answer?
Yes.
Yes.
Veterans are considered vulnerable. What about a 19-year-old substance abuser?
Yes.
Substance abuse is considered vulnerable. What about a 31-year-old with HIV?
Mhm.
Absolutely. What about 23-year-old with vaginal candidiasis?
No.
I'm gonna say no. Because I don't.
Pardon me?
I said no.
Yeah. So
Maybe-
your correct answers are B, C, and D.
Yeah. These.
Does everybody understand that?
Indeed.
Okay. Number 5. Excuse me. Which statement reflects the term resiliency as it relates to vulnerability? What is resilience? What's resilience?
Oh, just overcoming your obstacles.
Mhm.
Yeah, very more strong, very more like challenge your goals more.
Just working through things, right? Being resilient, being strong, being motivated, becoming knowledgeable, educated, just resiliency, trying to just work through challenging times. And that's one of the things in community nursing that it's going to come up a few times over the course of the class, over the course of this term, is we as community nurses really have to work on building resiliency with our clients, especially the vulnerable clients. They don't have a lot of resiliency, right? It's up to us to help them, whether it's healthcare access, whether it's resources, whether it's programs, classes. I mean, think of the substance abuser. Think of the whether it's drugs or alcohol. Think of maybe the lack of resilience that they have in the crisis mode, in their time of crisis. How do you help that particular client build resiliency? Does that make sense? Think of the homeless population. one of our goals with working with these big vulnerable populations is to try and increase their resiliency, to try and give them a better shot. So, which statement reflects the term resiliency as it relates to vulnerability?
A. Is it A?
Yeah. Resiliency reduces our vulnerability. Why is that? Why is A the correct answer?
Because
We are the less vulnerable to certain risks because we are more strong. We know how to go through
Exactly.
that.
Right. The
circumstance.
more resilient we are, the more it reduces our vulnerability to certain risks. B is the opposite. Resiliency decreases the likelihood that we'll get sick. And resiliency doesn't depend solely on genetic predisposition. Plays a part in it, but it's not solely responsible. Right? And then D is incorrect. Resiliency can be learned. In fact, it is learned. Right? So resiliency is a big part of our health education and health teaching and health maintenance. Because out in the community, we're working with vulnerable populations all the time. Okay. Question 6. This would be a med-surg question. Thinking, this is more of a safety question, right? ABCs. Which child? There's no doubt that every child needs to get seen. No question about that at all. But the question is asking who needs to be cared for first. What's the answer?
is it B?
Benayo.
Yep, it's B. Why is it B?
Unable to
Because he
breathe.
didn't have an asthma attack.
Exactly. What are those the symptoms of? Cough and unable to
Cough.
participate.
Asthma.
That's a pretty good sign of it, maybe an impending asthma attack,
Yeah.
right? So if you look at your ABCs and safety first, that's the first kid that has to get seen, right? The other three, yes, they do have to get seen, but if the question is asking us to prioritize. So that is an ABC safety priority question. And the question says first, who has to be seen first? So it's asking you to prioritize. Did anybody have a different answer than B?
I chose C because
Which one?
of I
I
chose
chose
C
C too.
because
Okay.
of safety, like their eyes is burning, and B says a cough. It didn't say difficulty breathing. Now, if it would have said difficulty breathing, I could have went for that, but it's a cough. Like you can cough from having the flu or something like that. So that was kind of confusing. Like if your eyes is burning, then you can't see. That can increase your risk for falling or hurting yourself because your eyes is burning. So the first thing you're gonna do is close your eyes. I don't know. That kind of confused me for the simple fact that it is cough, not difficulty breathing.
Okay.
I went through the ABCs to resolve that one.
You what?
I go through the ABCs, air, blood circulation, all this.
And what answer did you come up with, Celine?
Then the second one, then
Okay,
I
all right.
Yeah.
Okay, so
first
based on-
priority in the ABCs, I say it's that one.
all right, so I'm going to say this early and often in this class. You can't add information into the question on your own. Okay, so DeChantel, based on yours, you made the assumption that you made a few assumptions, pardon me, that weren't part of the question. Okay, one of the key test taking strategies is you only need the information in the question to pick the answer. Don't be adding things in there. Well, what if? or what if this was going on, or what if this was going on? If it's not in the question, it's not part of the answer. Does that make sense? So we need to make the assumption that through your knowledge of asthma, right, that if a kid's complaining of a cough and is unable to participate, then they're probably having difficulty breathing. Does that make sense? So this is a good practice question of just look at the answers and what's in the answers. Don't add anything into it. Does that make sense? When I do reviews with students after exams, it's amazing how much information is added into the question that's not actually there. And I'll say to a student, well, where did you get that information? Well, I just thought that maybe if they were doing this, then they were doing this. Was it in the question? Nope. Nope. I mean, just knowing that somebody's complaining of a 9-year-old's complaining of a cough and unable to participate, that should just tip you off that they're coughing and they can't participate. That's a potential airway issue, right? Does that make sense? Okay, question 7. Which food should the nurse recommend for a child with iron deficiency anemia?
Is it milk?
Eggs.
Eggs.
Oh, it's eggs.
Yep. Why is it eggs?
Because I guess it's high in iron.
Eggs have iron.
Mm-hmm. And this is in your week 2 reading, right? Common childhood ailments. Your iron deficiency anemic child. Why eggs? Protein, right? And I think that the way you have done or performed on exam 1 is probably a direct result of how much you prepared, right? Because these are all topics that were covered in your notes. All right, so a school nurse notes a dark discoloration along the neck crease and in the armpits of a child. Okay, well, first off, what is this a potential sign of?
Diabetes.
Yeah. And so what would you do?
Advise parents to obtain full medical evaluation.
Exactly.
Second one.
Got it
Exactly.
wrong.
Exactly. Because this is a pretty common occurrence for potential childhood diabetes. Right?
Yeah.
Okay. Question 9, which nursing intervention is a priority? Again, a key word. You got to be able to pull out those key words. Priority for a child experiencing developmental delays. Now, before you answer, this is an excellent example of a question. So if you have a question that looks like it could have potentially more than one right answer, and it's not a select all that apply, what should you do?
Go for the more higher, probably most words to the lower.
Nope. Well, you could, but the correct answer is go back and reread the question. Did you miss something? All right. It's not a select all that apply. You're looking, going, that could be right. That could be right. Go
Yes,
back and
because
look at the
for
question.
me,
It's
And the
What?
question is, I will say, my
Priority.
priority for development.
right. So it's asking
what-
for the priority.
Yes, so
Okay.
I think so evaluate environment is not priority. Assess ACEs, lungs and sounds and heart sounds can be a priority for me. And determining family history is gonna be a priority. Advice increasing iron intake and diet, it cannot be a priority either. So,
Okay. So If those are all priorities, what's the top priority?
For me,
Well,
access lungs and
the-
air.
The lead exposure,
Yeah,
'cause that
lead.
that leads to developmental delay.
Yeah,
And was lead exposure one of the topics we covered in week 2?
yes.
Yes.
Right. So, like Celine said, the other answers could be, well, not so much 2, but 3 and 4 could potentially be okay answers, right? But you got to pick a priority. You have to prioritize. Okay, so yes, evaluate environmental for potential lead exposure. Okay, we know through your readings that one of the potential complications with lead exposure is developmental delays. All right, so that would be first and foremost. We need to figure out if this child has had lead exposure. Yes, we can do C and D, but that doesn't have to be done right off the bat, right? Okay, question 10. So the nurse notes a child's BMI is in the 90th percentile. That's pretty high. Which intervention is appropriate?
The third one.
Encourage parents to reduce
See.
overall screen time.
Get up and move,
Yeah.
right? Obviously, we wouldn't do A, would advise less frequent snacking. There's no need to refer for an urgent medical evaluation. This is hopefully being handled by the family and their physician, right? There's no urgent need to run and get a medical evaluation. We already know the BMI is in the 90th percentile, right? Encourage to reduce screen time. That's the correct answer. And D would never happen, right? Recommend 100% fruit juice. You wouldn't do that, right?
No.
Mm-mm. I think I overthought this one because the 90 percentile, I was thinking about obesity or diabetes and things like that. So yes, I did refer to urgent medical evaluation just for those diabetes and stuff like that, because we did talk about type 2 diabetes mellitus or whatever in section 2. So I think I was thinking too hard about it.
You were adding information that wasn't there.
Absolutely.
Okay, so Kadisha just brought up a good example of adding information that wasn't in there. Sure, you want to think about that, but that doesn't require urgent medical evaluation. That's to be covered with your doc the next time you go in and visit. Hey, why are we at the 90th percentile? What's our plan? Let's come up with a plan. But certainly the risks you mentioned are possible, but let's start with get moving. Reduce the screen time, up and exercise, those kinds of things. Okay. So, what are your any questions about the quiz? Can you figure out which ones you got wrong based on going through it?
Yes.
Does
I
it
got
make
another question about number 1, Miss Marvel.
Mhm.
And I was just like thinking about the key terms like provide, like educating and things like that. Can we use those type of terms for based and oriented,
Sure.
if you get what I'm saying?
The big difference, Kadisha, is that one is population focused and one is individual focused. We're always going to be doing education, whether we're oriented or based, right?
Yes,
Does that answer your question?
pretty much.
Well, let's go through the notes here. So let's review the week 1 notes. We had 4 topics to cover. Is it help? I have a question because I just knew this term. Was it helpful to put the concepts and the readings in the beginning of the notes? Do you need all that
Yes.
information or was that too much?
No, that was good.
Because I really just kind of copy and pasted it from the announcement. But I didn't know if it would be helpful to have on this as well. All right. So did everybody from last week, does everybody understand where you get your Canvas course notes?
Yes.
Okay. You have readings in the book and you have readings within the module. If it says anywhere in the syllabus, any week, on any of your weekly notes, see Canvas courses, those notes are built into your module. Okay. So the way I come up with these blueprint notes is I take the concepts that we're covering this week 1, those 4 up here: introduction to community nursing, levels of healthcare prevention, healthy people, introduction to vulnerability, and I build kind of a summary. So the way I come up with these notes is I try and follow along right with the concepts. And these notes are really kind of bullet points, a summary. And I take it from the readings. I take it from my own lecture notes, my instructor resources. Okay. And build the most important, because really the purpose of all these concepts is for you to understand each concept. Okay. In an overview way, to understand how it plays into community nursing. Does that make sense? So your notes should follow right along with the concepts. All right. But as you're preparing for each class, make sure you review these notes and make sure you review your readings. And I want to show, I don't need to show you, I can tell you. If there's a full chapter to be covered in your readings, like here, you have full chapter 1. You can see in your reading page of your module, it gives you the PowerPoint. You see that? Chapter 1, it's right in your readings. It gives you a PowerPoint. So for this week, it gave you PowerPoints for chapters 11 and 12 in your, let's see, right here. So you had 2 chapters in your fundamentals book for this week, chapter 11 and chapter 12. When you have full chapters, you'll get the PowerPoints, but you won't get the PowerPoints for all these abbreviated, a couple of pages here, a couple of pages here. You're not going to get the full PowerPoints because you're not responsible for the whole chapter. Does that make sense? So when you see PowerPoints attached to your weekly notes, those are full chapters. Does anybody have any questions about that? Because if I were to give you the PowerPoints on all of these, you'd have another 8 PowerPoints, but you're only responsible for a few pages in each of those chapters. Make sense? Okay, let's go through. We've talked about introduction to community nursing. What's community-based? What's community-oriented? So as I said, as we're reviewing the quiz, public health in general is the big umbrella. Okay. Community nursing is a specialty area that falls under public health. All right. So community-oriented nursing, public health are used interchangeably. Okay. It focuses on the health promotion and maintenance in populations. All right. One of the things that we're going to go through all the time in this class is levels of prevention. Have you heard about these in other classes?
Yeah.
Do you know about levels of prevention?
Mm-hmm.
Okay. We have primary, we have secondary, we have tertiary. For all the concepts that we cover, there are primary and secondary and tertiary for each one. We have to be able to take the concepts that we cover and come up with what would be a primary intervention, what would be a secondary, what would be a tertiary. Some of the feedback I got from last term students when we were assessing the HESI in week 12, they said that there were a lot of primary, secondary, tertiary questions on HESI. So one of the things I think we should do as we go through week by week, so like, for example, when we start to talk about the migrant population, Let's talk about what would be a primary intervention for the migrants, what would be a secondary, what would be a tertiary. All right. So we have to be able to take each concept and apply all these three levels to that concept. The underlying premise of the concept will always stay the same, but we can make specific interventions for each different concept we're covering. Does that make sense? They said there were multiple primary, secondary, tertiary. So as we go through all these concepts, be thinking primary, secondary, tertiary. Okay. So primary, here's the way I think of it. Here's the way I remember it. Primary is P, secondary is S, tertiary is T. So primary is prevention, secondary is screening, tertiary is treating. Does that make sense? The one thing I want to point out early on is a lot of students put education, oh, we're going to educate them to prevent it. But education is at all three levels. Okay. In the primary level, we're educating to prevent. Right? In the secondary level, secondary is also considered, I know it says S for screening. It's early identification and early intervention. Okay, so like mammograms, pap smears, blood sugar checks, blood pressure screenings. But it also requires education. Let's say we have identified a high-risk group for diabetes, a high-risk group for obesity, a high-risk group for substance abuse through our screens. We still have to educate that population, right, of how to try and reverse that trend so it doesn't get to a tertiary, right? So education happens, that's how education happens at the secondary level. And then tertiary is treatment. So the key for tertiary is they already have to have something going on. An illness, a diagnosis, a disease, an injury. Okay, because tertiary is focused on management. Okay, how do we treat a kid who's fallen off a bike? How do we help somebody who's discharged home from the hospital with a stroke? How do we help teen moms with new babies? It's all tertiary. Something is already going on. Okay, so we're either trying to educate, let's say a kid falling off a bike and has a TBI, educate on safety, right? They already have something going on. So we could be trying to help manage the symptoms to try and help improve the quality of life. It could be as simple as medications, right? Let's say you're doing an elderly visit and they have a bunch of medications. Simply educating them on when to take them, what the side effects could be, that's tertiary. They're taking them for some reason. Does that make sense? So primary, secondary, tertiary. You're going to hear that all term in all your exams, and apparently including in your HESI, there are primary, secondary, tertiary questions. So you got to have a good understanding of it. Second concept from week 1, healthy people. Did everybody get a chance to get in there and look at the Healthy People 2030 website? Pretty amazing. Really amazing. The national directive or national guidelines. And it says right here in your notes, Healthy People 2030, their national objectives to improve the health and well-being over the next decade. Okay. And here's their overarching goals. You can have a look at that. Social determinants of health is something we're going to talk about this term. Okay. Depending on where you were born, where you live, where you're educated, where you work, where you play, where you worship, right? All these play into what we call social determinants of health. Okay? The 5 factors of social determinants of health. Think about it. Just think about people that live in your community. Everybody has different has a different pathway. But there's 5 major domains of how your pathway is evaluated. Economic stability. Do you live in poverty? Do you not live in poverty? Do you have access to good education, good quality education, or do you not? What about healthcare? Do you have access to healthcare, quality healthcare? Number 4, what's your neighborhood like? What's your environment like? Do you live in a town, city, suburb with high crime rate? Do you live in a suburb that has a high, or city that has a high homeless rate? Mental health issues? And then social and community. What kind of resources? What's your community like? Are there a lot of youth sports? Are there a lot of playgrounds? Are there a lot of rec centers to gather? Right? So if you look at these 5 domains, that's really how your social determinants of health are kind of mapped out. Right? Let's say you live in poverty. You don't have access to good education for the kids. You don't have any insurance. So you have less access to healthcare. Let's say your neighborhood is in decline with crime, gangs, whatever. And let's say your neighborhood doesn't have a lot of social resources. What do you think is going to happen? You think that's going to put that family in very high risk? Or that individual at very high risk? Yes. Yes, yes, yes. And a family living in that situation, think of all the additional challenges they may have. Maybe substance abuse, maybe mental health issues, maybe poor nutrition for the kids, right? And here's some of the things we just talked about. Social determinants of health, those 5 domains, have a major impact on people's health, well-being, quality of life. Safe housing, transportation, neighborhoods. Is there racism? Is there discrimination and violence? Are there job opportunities? What's the unemployment rate? Do you have access to nutritious foods, physical activity opportunities? We'll talk about this polluted air and water when we get to the environmental health section, but what if you live in a community that's industrial, or you live near a power plant, or you live near a river, lake, whatever, with contaminated water? Right? Those are all environmental risks. And then language and literacy skills, huge challenge in our communities. Right? With all the migration and all the different diverse cultures that are living in communities now. Think about being a community nurse or a public health nurse and the challenges that come with all the different languages and certain cultures not able to understand our language or understand healthcare, understand how to access it. And literacy skills. One of the biggest concerns, and we'll get to this down the road in the term, but one of the biggest concerns in community nursing is low literacy. And I don't mean that as a derogatory term, but there's high levels of low literacy with regards to healthcare. Okay? And we do know that social determinants of health contribute to disparities and inequities. Okay, so, and then the introduction to vulnerable populations. Okay, I'm sure you guys have read this, but we know that vulnerable groups can be based on location. Okay, why are kids vulnerable? Right? They can't advocate for themselves. Right? The world, when we refer to the international guidelines, it comes from the World Health Organization. You guys have heard of the WHO, right? WHO. Right? They consider children particularly vulnerable, right? Because they can't advocate for themselves. Okay? And then the elderly is another big vulnerable population. chronically ill is a very vulnerable population. Okay, most of our resources in community and public health go to chronically ill clients. Does that surprise you? No.
No.
All right. People with chronic illnesses, they're at risk for poor health outcomes. And this is very prevalent in the rural communities. Next week, we'll talk about the rural communities. Chronic illness is very, very prevalent. People don't seek out primary care. Okay. We address this a little bit, the non-English speaking community, right? So if you have a non-English speaker, they immediately become vulnerable to whatever adverse health outcomes, even if they have health insurance, because they're unable to communicate with the healthcare team. All right. And here's where we talk about resilience. Resilience, the ability to resist succumbing to health risks. Right? What is resiliency? Where does it come from? Can someone learn it? Discuss childhood mental health, feeling in control or out of control. All right. Resiliency is influenced by early life expectancies or experiences, excuse me. The students who got the resiliency question correct, this was all included in your notes. Okay. Poverty. This is very important, and you'll hear this throughout the term. I want you to remember this. Poverty is the primary cause of vulnerability. Well, think about it. If you're living in poverty, what does that affect?
Your
Everything?
ability to get good care.
Everything. Right? It leads to healthcare issues. It leads to education issues. It leads to nutrition issues. May lead to transportation issues with getting to back and forth to doctor's appointments. Okay, may lead to hazardous jobs, homelessness. Right? So this is really important, being a major cause of vulnerability. Okay. And then these are the other veterans we talked about. That was in your quiz. Outcomes of vulnerability. Without intervention, lower health status, increased morbidity and mortality, high prevalence of chronic diseases, high levels of communicable diseases, TB, Hep B, STDs, HIV, much higher mortality rates than the general population. Okay, so what are our nursing interventions in the care of vulnerable populations, right? So as a community nurse, our interventions are to try and increase resources, to try and reduce health risks, to try and reduce health disparities. And here's a whole list of things that we can do. Okay, this is what community nurses do with the vulnerable populations, all these bullets. Okay, I want to point out a couple down here. Show respect, compassion, and concern. Okay, do not, I'm down here. Really important to community nurses. Show respect, compassion, and concern. Do not make assumptions. Let them tell you their story. Okay, ask open-ended questions. One of the things that comes up in community nursing is trust. Well, it comes up in all of nursing, but when you're caring for vulnerable populations, the very first thing the nurses you need to do is try and establish a trusting relationship. They're not going to open up to you, okay, unless they feel like they can trust you. A lot of vulnerable populations clients don't like to discuss what's going on. All right, it really takes a lot of compassion, care, understanding, non-judgment with these particular populations. And one in particular would be the homelessness. And we'll talk about that when we get into our homeless section. Okay, So the introduction to vulnerability, please, if you haven't read that section in your notes, read it. Okay, because I think after next week, we just week after week, we're talking about vulnerable populations, specific vulnerable populations. These first 2 weeks are kind of an overview. Okay. Any questions about week 1? Did the video I sent you, the recording, help?
Yes, it did.
Did you guys watch the video?
I did.
Anybody else watch it?
No.
Yes.
If you haven't, watch it, because it just amplifies all of what we just talked about. So this week, school nurse, growth and development, and then common childhood ailments. Okay, and this week's discussion question is common childhood ailments, right? Where you pick 3 and answer a few questions about each one. We also talk about family nursing, family health risks. Okay, and I've listed out all your readings. There's a couple of PowerPoints in there. Okay, you've got a couple of Canvas readings, your school nurse and lead exposure. Okay, so what do you think of when you think of a school nurse? What do you think a school nurse does? Think she just put band-aids and hugs, or is it more than that?
No, assesses for possible problems.
Mhm.
Can screen like first like scoliosis.
Mhm.
Or like different things.
Mhm. So I just retired from school nursing. I was in school nursing for over 20 years. And I can tell you, at least I remember growing up, and I'm aging myself, but kids came to the clinic for hugs and kisses, right? And band-aids and ice packs. I can tell you that school nurses are now a very integral part of the healthcare team, the school healthcare team. Things that we were doing when I retired, we were doing trach care, right? Suctioning, IV antibiotics, through a PICC line, cathing students, male and female, diabetes management, insulin pumps, giving insulin shots, insulin pens, caring for seizures, emergency medications for seizures. Very inclusive. We had schools that had programs for the severely impacted, wheelchair bound, trach bound, nonverbal. School nurses do pretty much everything at this point. And for those of you that have kids in schools, you probably understand that. Do you not? School nurses do tons and tons of things now that they never used to. Some of the roles of the school nurse, direct caregiver. I just provided you some examples of what we did in the schools. All right. Medications. Lots of kids are on medications now. Okay. We oversee that. We're an educator. We provide health information to students, to parents, to teachers, to administrators, to community. Okay. Some may be primary. For example, my day could start in a preschool and end in a high school. Our model in Colorado, or at least the district I was in, we were nurses for multiple schools. We had clinic aides in every school that did the day-to-day things that we would delegate. And we covered several schools. So my day could start with, as far as education, could start with talking to preschoolers about good hand washing. And the day could finish up with high schoolers talking about drug prevention, safe sex. Okay, so a lot of the school nurse's job is an educator, right? You may be talking about growth and development, puberty, substance abuse prevention, hand hygiene, acute illness prevention, suicide prevention, obesity prevention. And then we were a consultant to the parents and the teachers. You know, if kids were diagnosed with diabetes or kids had a new diagnosis or had a bad injury and were coming back to school and needed accommodations for that. We dealt with all that. Kids with complex chronic illnesses, we were the coordinators of care, PT, OT, speech. Okay. And then we participated in community outreach, participating in health fairs, vaccination days, right? Coordinating with other organizations to come into the school and prevent, have law enforcement come in and talk to the high schoolers, or have mental health team come in and talk to high schoolers. So lots is happening in the schools right now. Okay, this is an excellent example right here that I want you to have a look at. Prevention in the schools. It goes through primary. So I've already outlined this for you. Secondary and tertiary examples in the school. All right, so remember I said each concept we go through, we need to be able to identify interventions at all those levels. Right, so primary, a couple of examples here, providing education and prevention on injuries. Right, seatbelts, helmets, playground safety. Prevention of substance abuse behaviors. So your prevention, remember, we're trying to prevent a problem before it even occurs. Okay. Prevention of substance abuse behaviors. Try and reduce the risk of disease. Talk about vaccinations. Talk about obesity. Type 2 diabetes. Okay. Diet, exercise, lifestyle risk. We had a huge department in our district. It was huge. It was like 90,000 students and 200 schools. So we had a whole department on health and wellness. Okay. And we had programs in all the schools, just tons and tons of health and wellness. And your organizations that you work for right now should have those kind of resources to you as well. Okay. Secondary. How do we screen for kids at risk for substance abuse? How do we screen for kids at risk for smoking, for mental illness, for bullying, for harassment? How do we screen for lice, chickenpox, flu? Remember, screening is early identification and early treatment. Okay. Screening for abuse and neglect. Right? You have a lot of that in the schools. I did a lot of that screening in schools for abuse and neglect and reporting to children's services. So secondary is really important in the schools because you're screening kids for a lot of different things. I mean, you have kids from different age groups with different backgrounds and different experiences coming in all the time. Make sense? Vision hearing screening, scoliosis screenings. I talked about bullying. Okay, tertiary, treating and managing an existing condition. So we're still talking about schools. Medication administration. Okay, these kids are on medication for something, for a particular diagnosis or condition. Right? If the student is already listed as, has an IEP, they need specific educational accommodations called an IEP. That's tertiary prevention. They've already been identified to have something that's preventing them from being successful in school, whether it's a developmental delay, a speech issue, a physical issue. Okay, that's tertiary. Okay, teaching students and parents how to manage their chronic illnesses. I did a lot of work with this. We had a lot of complex chronic illnesses in the schools. Allergy, asthma, diabetes, seizures, CP, lots of stuff going on. So they already had something going on. So we did a lot of education with students and teachers and parents and administrators on how to safely care for these kids with complex chronic illnesses. It's all tertiary. Okay, so have a look at that list. Okay, I just covered it briefly, but this is an excellent list for primary, secondary, and tertiary with regards to school nursing. Okay, family nursing, family health risks. Remember, in a community, in the community setting, our client could be an individual, could be a whole family unit, it could be a segment of the population, say the homelessness, or the elderly, or the kids, or it could be the whole population. So we have all different kinds of clients, right? Family nursing, family health risk. What is a family? What is a family these days? What's a family? How do we define a family?
A group of people who love and care for each other
Mhm.
and support
Fi-
each other.
Financially, emotionally support each other. There really is no definition of the normal family anymore, or the family anymore. It's whatever the family defines as their family, right? Whatever they say it is, right? Family in definition is people who provide physical, emotional, financial support. Non-traditional families are the norm now, right? So when we talk about families, we think of, for purposes of your readings, functional versus non-functional. Okay, or what are some other synonyms? Not functional versus non-functional. Not good versus bad, but there's a difference between a functional family and a non-functional family. Okay, there's 5 functions of every family. It's like the domains for, there's 5 domains for social determinants of health. Well, there's 5 functions for every family. Financial. What's the financial status of the family? What's the health status of the family? Reproduction. What does that look like in the family? Socialization. Okay, and affective. All these together make up whether your family's functioning or not functioning. And there's some examples for each. For example, with financial, what's the financial makeup? Are you living in poverty? Are you able to plan for the future? Are you able to make good financial decisions? Are you able to provide housing and insurance for your family? Right? Health. Does the family practice healthy, teaching healthy behaviors, teaching health maintenance, providing caregiving? What does that look like? Some families it may be positive, some it may be negative. Reproduction. What are the family's choices and affordability of having children? Socialization. Do the parents help the kids be raised into fitting into society, to become productive, responsible, and well-adjusted adults? Do they pass on spiritual, religious, cultural beliefs? Right? And then affective. Affective is that feeling part. Okay. Do we help create a sense of identity and belonging to our kids or to our family members through love and affection, time together? Okay, so those are your 5 functions of a family. It looks different in every single family. Okay. Right. So failure to meet some of these, some or all of these function leads to dysfunction and crisis. Okay. A strong contributing factor to the future of a family it's impacted by substance abuse, anxiety, depression, work issues, unemployment, unsafe sexual practices in a dysfunctional family setting, right? We know that family is our first and most important safety net. Safety net and social support system, right? Without it, tendency toward maladaptive behavior and coping mechanisms arise. Okay. What are some family health risks? right? Disease develops in response to 3 contributing factors. So here's your family risks. You may have a genetic risk, an environmental risk, or a lifestyle behavior risk, right? When we're caring for a family, we need to consider all 3. So some genetic risk is some of us may be born with certain predispositions, right? Maybe you have a family history of cancer, you have a family history of stroke, you have a family history of developmental delays, substance abuse, mental illness, heart disease, premature births. Okay. So family histories, when we do family histories with our families in the community, they're extremely important in helping us identify genetic risks. What are some environmental risks, right? What's the social environment? What's the political environment look like? What's the physical environment look like? High crime neighborhoods, pollution, living conditions, high stress environments. Maybe there's discrimination based on race, social status, religion. Okay, what about immigration status in communities? That's an environmental factor for family health risk. Okay, lack of adequate financial resources, social resources. Okay, those are going to lead to crisis. And then behavioral. When we talk about family health risks, these are your choices. Okay, do you eat unhealthy? Okay, eating unhealthy, obesity contribute to your chronic diseases. Okay. So, the other one is exposure to secondhand smoke. Right? So anyway, read through this section of family health risks, okay? And then the last section is your common childhood ailments. Okay? This is more peds focused. Okay? And you should be familiar with all of these. I have really tried to limit, you're probably going to read more about it in your readings, but I've tried to limit it to the bullets that I think will help you understand each concept. Okay, so you have asthma, which you had a question on. You have eczema. Okay, please read through that. Type 1 diabetes, conjunctivitis, scabies, lice, ADHD, iron deficiency anemia, scoliosis, and lead exposure. I can tell you, you got to read through that. Okay, I'm not going to go through each one of them, but I can tell you that I think I'll have to wait and see, but I think there's a question on the exam about each one of those. Okay, so that's that section of week 2 is your med surge. Remember I said this class is heavily med surge focused? Common childhood ailments is med surge focused. The different of why it's in the community setting or community class is we may be caring for people with all of these in the community. Does that make sense? So yeah, you learn about med surge, but you might be, maybe you're working in school nursing. And I took screen for lice, did conjunctivitis, did, half of those rashes, eczema, diabetes. If you're working in school nursing, I took care of all those kids. All right. If you're working in occupational health, which is the work setting, right? If you're working in occupational nursing, you're going to see a lot of that as well. So common childhood ailments aren't just in the hospital setting. In fact, you're going to see most of them in the community setting. Does that make sense? So that's your week 1 and 2 content. Does that help put things in perspective better?
Yes.
What do you guys think? Is that too much information? Okay, where are we at? What are we
It was
thinking?
great. I got a question though, Ms. Marvel.
Yeah.
You said after reading the pages that you have on the asthma and things like that, the bullet points are the most important things that we should focus on those pages, or?
So the book readings are going to give you the big overview,
Right.
which I want you to have. Okay, and then we'll start to be more targeted in the important things we need to pull out to understand each concept. That's where my notes come in. So while
Okay.
it's important for you to have an overview of the concepts from your readings, we'll talk each week about the most important points with each concept that you'll need to know, which is what eventually you're going to be tested on. Does that make sense? So, well, yes, I want you to do the readings to get the full picture. In class, we're going to be much more targeted. Right? Does that make sense?
It makes sense, I think, for me.
Okay.
It's trying to understand how to answer the questions correctly. I did terrible on the quiz. And for me, community remind me of gerontology. And it's trying to decode how to answer the question directly. I can understand the material and what I'm reading, but when it's being placed in like test format, that's where I'm having
Exactly.
some confusion at. So I did take a few notes over the quiz when you broke it down with the difference between community oriented and community based. Like even though I read over the material, when you just put it in quiz form, my mind went blank.
So, yeah, thank you for that. Thank you for that. So, listen, I think I told you this last week. We are now moved into the next gen format. Okay. You're not being tested on your memory on the exams and the HESI. You're being asked to take the knowledge that you've learned and put it into a clinical setting. So look at your quiz you just took. They're clinical questions, right? You're taking your knowledge about lead poisoning. And now can you take care of a kid with lead poisoning or recognize a kid that might have potential lead poisoning? All your quizzes and exams are clinically focused, taking the knowledge that we just talked about for the last hour, putting it into practice. So, DeChantel, with your question, it's difficult to transition from the knowledge-based questions to the clinical questions. But remember, when you guys graduate in a little bit, it's fine to have the knowledge, but if you can't put it into practice, it's going to be a long orientation process for you when you get into nursing. And so I'll give you my little tidbits over the course of the term as far as test taking and my advice and my guidance, but I've already given you a couple today. But DeChantel brings up a good point. It's the challenge of the transition from knowledge-based questions to clinical-based questions. It's already assumed you have the knowledge, right? Through classes.
Also different. It's
What?
also different in this class because in the other classes we're like in a hospital where we're assessing for the illness, but in the community, basically we're educating or whatever. We're giving them resources or whatever. So in our heads, we're thinking like, oh, like she was saying, how the eyes or whatever, oh, we got to treat that first because we're used to doing medical stuff and treating illnesses instead of thinking of the bigger picture in the community and looking at every aspect.
Exactly.
It's
Exactly. And think about it. Your clients in the hospital, once you get them into the community, that's already going to be at the tertiary intervention level, right? Because they're coming home with something, right? Think about it. Primary, and it would be wonderful if primary and secondary could be the main focus in public health nursing. Wouldn't it be great to spend all your time trying to help prevent things, educate on how to prevent things, and screen for potential complications or potential diseases, potential chronic diseases? Wouldn't it be great If we could focus all of our time on primary and secondary, think of how healthy we would be. But unfortunately, right now, a lot of community nursing is focused on tertiary interventions. Those complex, the biggest issue in community nursing is chronic disease. Does that
Now
make
that makes-
sense?
Yeah,
That-
now that made sense when it comes to answering the questions. That did. I think that'll help me some if I put it in that perspective.
Yeah, I mean, think about it. You're like, I don't know, DeChantel, if you heard me from last week, but my student last week in our exit whatever meeting, or the week before, she said, if you asked me to describe this class now that I've gone through it, I would have never thought this at the beginning, but she said this is like a med-surg class in the community. Think about it. If you are community-based nursing, meaning you're in the community caring for illness, I can see how she would think that would be a med-surg class, med-surg in the community. Because if you're a home health nurse and you're going door to door caring for patients, you need all those skills, right? If you're community-based. Now, if you're community oriented and you're focusing on health maintenance, health education, maybe it's not as med-surg focused, but most of the care in the community is community-based. Do you think people go home from the hospital and don't need a continuum of care in the community? They do. Especially the the chronic illnesses, right? There has to be a continuum of care. And that's why your fundamentals, your foundations, your Jerry, your peds, your med-surg, your OB, it all comes to play here. Right? I mean, think about it. This is just care. You're just shifting your care from the hospital into a big community setting, whether it's a rehab facility, a long-term care facility, an urgent care clinic, a medical office building, a home, a clinic, a health fair. Make sense? Okay. All right. So those are weeks 1 and 2. All right. I hope this helps. I'll send out the recording for this in case you missed any part of the class or you have to review it. I think the quiz was pretty straightforward. I reviewed the quiz again this morning, and all the information on the quiz was covered somewhere, whether it be in your notes or in your readings. Okay, so my suggestion to prepare for class for the quizzes, just have a look at your notes, have a look at your readings, and you'll be fine. Okay? Questions? You're starting to get a little bit bigger of a picture of what all has to be done in the community.
Mhm.
I mean, when you're driving around the community and you see long-term care facilities and nursing homes and all, how do you think that's community nursing, care in the community? And who do you think works with your homeless populations and your substance abuse and mental health clients, teen pregnancy? Those are all your community nurses. Nursing, it just doesn't happen in the hospital setting. Okay. All right, listen, I held you over a little bit. I promised. I took up the break time, 8 minutes of the break time, so I apologize for that. Anybody has any questions? We are all done. You can stay on after. I'll get you the documents that I said I would get you in the next couple of days. I hope you guys have a good week. You reach out to me if you need anything. Okay, I think I'm traveling a little bit Thursday back up to Wisconsin, but I'll only be unavailable for a couple hours. So reach out if you need anything by email or need to review what we just went over, whatever you need. Okay,
Okay,
you gotta
thank you.
you gotta be successful in this class. There's no options here. We gotta be resilient. We gotta get through it. Okay, so have a good rest of the week.
Thank you so much. You too. Bye.
Good to see everybody.